Today's topic is anxiety. Um, I'm Dr. Agila, Assistant Professor, Department of Psychiatry, SLIMS BIHER. Now, what is anxiety? Now, here we have it's a feeling of worry, nervousness, or unease about something with an uncertain outcome. Like we are just worried because something might go wrong somewhere. So, now that is anxiety. Now, here we have some actual definition, that is a chronic condition characterized by an excessive and persistent sense of apprehension with physical symptoms such as sweating, palpitation, feeling of stress. Now, usually when we have anxiety, the first thing we feel is a feeling of stress and a feeling of insecurity and a feeling of um, coldness within inside. Basically, at that time, it's difficult to think, and it's also difficult to process things that are there in front of us, but still we go under a trance or just a freeze. So it's like we are just so much apprehensive that otherwise, which could have been a normal situation, because of the apprehension and fear could become worse. So that's how dangerous anxiety can be. So it's usually associated with sweating, palpitations, and feeling of distress, basically. So this is a classification of anxiety disorder: panic disorders, generalized anxiety disorders, phobic disorders, OCDs, PTSD, post-traumatic stress disorder, and other related disorders. Now, what is generalized anxiety? Now, why it's called generalized? Let's go into that. Now, GAD is usually characterized by a chronic, unrealistic, and excessive anxiety or worry that is uncomfortable to the point of interfering with daily life. Like, as you can see, it is not just 1 day or 2 days, it's going to be for a period of time, like at least 6 months or more. So imagine a person being in that state of mind for 6 months or more, which is going to be deteriorating in many aspects, because we'll be seeing the etiopathological origin of anxiety, in which there is a huge role for psychoneuroimmunology. So we'll be going into that soon. A person with GAD, that is generalized anxiety disorder, worries excessively and feels highly anxious at least 50% of the time for 6 months or more. So usually it is for a period of time. It's just not for few months. It's just 6 months or more. So excessive worry or anxiety about multiple issues which lingers for 6 months can be called as GAD. So it lingers for 6 months, and it is not like going to subside anytime soon. So it's going to be maybe more than 6 months. So, as with many mental health conditions, the exact cause of GAD isn't fully understood, but it may include genetics as well as other risk factors. Now, these factors may increase the risk of developing generalized anxiety disorder. Number one would be always, now let's have a biopsychosocial approach. On the biological side, it's going to be genetics and being born as a female itself. But even though women are anxious, or they are prone for anxiety, they tend to have this anticipatory anxiety. Like we can say the defense of anticipation works a lot in women, and that could lead to always futuristic thoughts and futuristic problems. Like she has that tendency to foresee things. So that itself could lead to that, when becomes pathological, is going to become GAD. So genetics, generalized anxiety disorder, may run in the family. And personality disorder, here we have different sorts of personality. Especially there's something called anxious personality, and it is like the temperament. The temperament is something which is key here, which is timid or pessimistic, and who avoids anything dangerous like harm avoidance behavior, and they may be prone to anxiety, generalized anxiety rather than others. And so these are the basic risk factors. So we have the medical condition in which these are the medical causes. Now, these are actually the medical causes in which there are psychological conditions, that is anxiety. Now, these are proven, like abnormalities in HPA axis, acute myocardial infarction, pheochromocytomas, substance intoxication and withdrawal, hypoglycemia, and caffeine intoxication. MVPs are one of the biggest causes of panic attacks and anxiety. CPS, complex partial seizures. Now, caffeine intoxication also. Caffeine is a CNS stimulant basically. So all these things could lead to uh, generalized anxiety disorder. So then we have the signs and symptoms of generalized anxiety disorder. Now, the symptoms of generalized anxiety disorder fluctuate. You may notice better and worse times of the day. Now, even before going into the signs and symptoms, I have to mention one here. Now, if you see, there is the HPA axis, that is the hypothalamo pituitary adrenal axis. Here comes hormone called cortisol. Now, cortisol plays a huge role, that is also known as the stress hormone. Now, when I mentioned psychoneuroimmunology, what I meant is the cortisol is going to be a huge key factor here in altering the hypothalamo pituitary adrenal axis. So, what happens exactly is that when there is cortisol overload, like you can just recollect from depression, there was non-suppression of dexamethasone suppression test. So all these are like correlated, because depression and anxiety, they are not very far from each other. So definitely cortisol is going to cause changes, alterations in HPA activity, and which in turn can lead to generalized anxiety disorder, because it's going to disturb the entire sympathetic tribe, that is entire sympathetic activity, parasympathetic activity. Now, parasympathetic is very much inactivated in GAD. That is its sympathetic overactivity. So you can imagine adrenaline high, adrenaline rush sort of. So obviously it's a sympathetic hyperactivity. Always remember, if we need parasympathetic to be calm and cool, so sympathetic hyperactivity is the biggest reason here. So always remember psychoneuroimmunology. Now, why I took immunology is that there are interleukins related to stress, that is IL-6 and IL-2. So interleukin 6 and 2 are related, which are actually increased. That is, this looks like an immunogenic response, that there is a compromise of immune system. It's not like actual compromise. There is suppression basically. It's not even like going to be like a full suppression, but it's going to be definitely low immunity, and people may have other opportunistic infections as well if it is going to be for a longer time, that is 6 months or more, or 1 year or more. And that is the reason during exam time we get stressed, and sometimes we catch all sorts of infections and cold and fever and stress related GI disturbances, if you can remember. So all these root down to psychoneuroimmunology. And here we have signs and symptoms. Now let's go to the signs and symptoms. That is, most people with GAD experience a combination of a number of the following, that is emotional, behavioral, and physical. So emotional will be constant worries running in the head, and feeling like your anxiety is uncontrollable. There's nothing you can do to stop worrying. Intrusive thoughts about things that make you anxious. You try to avoid thinking about them, but you can't. Basically, it's basically excessive, uncontrollable. It's not like uncontrollable, like an obsession. Here you can control, but it's more like a persistent worry and an inability to tolerate uncertainty. You need to know what's going to happen in the future. A pervasive feeling of apprehension or dread. Basically, the apprehension is the key to anxiety. It's heights of fear. It's just not normal fear. It's going to be a heightened fear. The peak is panic attack. So it's like mountains, right? Like, a small mountain and then a large mountain, and then there is the peak, the one with the tallest peak. So that would be the panic attack. And the one with the smaller peak, or just smaller than the big mountain, would be a anxiety, because the smaller ones are continuous and they run a lot. Now the large ones are very small, very less in number, and they're extremely peaky. So here we have the comparison of small mountains to anxiety and the peak ones to panic attack. So what do I mean is that because the fear, that is the apprehension, is the highest in panic attack. Like, it's an extreme state of fear which persists only for a short time. It's not for a long time. Now that is the difference between generalized anxiety disorder and panic disorder. Now it's only for a short time. Here it's for a longer time. That is 6 months or more. Okay. So this is actually dangerous than the panic attacks or panic disorder. So behavioral symptoms, if you see, inability to relax, enjoy quiet time, or be by yourself, difficulty concentrating or focusing on things, and putting things off because you feel overwhelmed, avoiding situations that make you anxious. Now, you have these symptoms because these are all behavior. Now, what happens to your behavior because of your emotions? Now, you cannot sit back and enjoy a movie if your mind is constantly on the go. Like, you will not be able to relax and enjoy, right? There will be difficulty you cannot study. How can you sit and study when your mind is continuously preoccupied with something, and there is something like, a train of thoughts running? So it's very difficult. Putting things off because you feel overwhelmed. Like, there's always like a feeling of overwhelming, like what's happening here and there, and like, avoiding situations that make you anxious. Now this is one important thing. There are situations that can make you anxious, and this comes to your personality, that is harm avoidance behavior. Now physical symptoms of generalized anxiety disorder are feeling tense. That is, now we are coming to the body. First we were in the mind, then we were in the behavior, like overall behavior, because of the emotion, behavior, cognition, and then now we are coming to the body itself. So in the body, what do we feel? The feeling of tense, like, the body is not relaxed. Like, that's why one of the biggest management is progressive muscle relaxation. Relaxing each and every muscle of the body from head to toe, from forehead to the small muscles of the feet as well. So feeling tense, muscle tightness and body aches, having trouble falling asleep. They can't sleep, they just can't sleep. And staying asleep because your mind won't quit, and feeling edgy, restless or jumpy. Like, there are nights when you don't just sleep and then you feel like really edgy, and then your body is really hot, and exam time. So that is how you can correlate stomach problems, nausea, because the entire system, sympathetic activity, is so overwhelmed. Actually, that word can be used here as well. It's so overwhelmed with all those inputs and it doesn't know what to do. So it's definitely manifesting in the body. So muscle ache, muscle tension or muscle ache. Then you have the feeling edgy, restlessness, jumpy, stomach problems like GI problems like nausea, diarrhea. Then we have the ICD10 criteria. This is F41.1. For children, it may be a different criteria, a period of at least 6 months, okay, with prominent tension and worry and feelings of apprehension about everyday events and problems. At least 4 symptoms out of the following list of items must be present, out of which at least one from items 1 to 4. Now, autonomic arousal symptoms. These are palpitations or pounding heart, or accelerated heart, sweating, trembling, or shaking, dry mouth, not due to any medication. Symptoms concerning chest and abdomen, difficulty in breathing, feeling of choking, chest pain or discomfort, nausea or abdominal distress. Symptoms concerning brain and mind, these are feeling dizzy, unsteady, faint, or light-hearted, feelings of that the objects are unreal, and this is derealization, depersonalization, fear of losing control, fear of dying. General symptoms are the hot flushes or cold chills, numbness or tingling sensation, symptoms of tension, that is muscle. Now, all these 13 were of panic attacks. Now we are continuing to symptoms of tension, that is muscle tension or aches, pains, restlessness and inability to relax, feeling keyed up or on edge or mental tension, a sensation of lump in the throat or difficulty with the following. Other non-specific. Now, these are the non-specific exaggerated response to minor surprises or being startled. Like, they are so easily startled. Difficulty in concentration or mind going blank because of worrying or anxiety, persistent irritability. Now, irritability is one such feature. It shouldn't be confused with mania because this irritability also can be throughout the day. It can mimic like mild mania, but it is definitely not going to be associated with other manic features. So it's going to be persistent irritability, difficulty getting to sleep because of worrying. Now, difference between normal worry and GAD. Now, normal worry, your worry doesn't get in the way of your daily activities and responsibilities. But in generalized anxiety disorder, your worrying significantly disrupts your job activities or social life. And you're in normal worry, you're able to control your worrying. In GAD, your worrying is uncontrollable. You cannot control. In normal worry, your worries while unpleasant doesn't cause any significant distress. These are extremely upsetting. GAD, it's extremely upsetting. It's extremely stressful. Your worries are limited to a specific small number of realistic concerns. Here, your worry about all sorts of things tend to expect the worst. It's just pessimism at the height. And here your bouts of worrying last for only a short period of time. Here it's minimum of 6 months. Okay. So this is a normal worry and this is GAD. Now we've all been through normal worry. Now apply with this. Have you ever been in a GAD state? Okay. So diagnostic criteria for GAD is like how to diagnose. Now do a physical examination, signs that your anxiety might be linked to an underlying medical condition. Now we've seen a patient who had MVP and who had a panic attack, and also there was persistent anxiety. So we almost missed the MVP. We just luckily went for a echo, and then after 6 months of being with the patient, we found out that it was a mitral valve prolapse. So always remember to look for the underlying medical condition, do blood tests, urine tests, and if any medical condition suspected, go ahead and treat that. Use psychological questionnaires to help determine the diagnosis. We can also use HAM-D and HAM-A. HAM-A is for Hamilton Anxiety Scale. Now DSM-5 is only excessive worries, similar about several events or activities most of the days of the week for at least 6 months, difficulty controlling your feelings of worry, anxiety or worry that causes you significant distress or interferes with your daily life, and then at least three of the following symptoms in adults and one of the following in children: restlessness, fatigue, trouble concentrating, irritability, muscle tension, or sleep problems. Anxiety that isn't related to another medical health condition such as panic attacks or PTSD or substance abuse or another medical condition. Now, GAD is often occurs along with mental health problems. Some disorders that are comorbidities. You can see phobias, panic disorder most common. Then we have depression, another common, and substance abuse, the next common, PTSD, the fourth most common, and then comes phobia. Actually, we cannot say here in percentage because phobia is anxiety basically in a heightened form. So treatment, we have pharmacotherapy and we have psychotherapy. In pharmacotherapy, it is also known as the talk therapy. So we start on cognitive behavioral therapy. Here we have different types of cognitive behavior therapy. Now we don't immediately start on medications if the person is having mild GAD, mild to moderate. So it's better to go for CBT and try it out. And if the person is really having physical symptoms, then it's definitely an indication to start with medications, pharmacotherapy. So here, what are the pharmacotherapy? First, we'll look into the pharmacotherapy, then we'll go into the CBT. Now, the drugs used for GAD will be benzodiazepines, buspirone, alpidem is an anxiolytic drug from the imidazopyridine group family related to more well-known sleeping medication, zolpidem. So alpidem is like zolpidem. So buspirone and then tricyclic or beta-adrenergic uh, antigens, that is propranolol. So here we have the medications, that is antidepressants, escitalopram and sertraline are widely used, that is selective serotonin reuptake inhibitors. Escitalopram, the starting dose can be 5 mg, as low as 5 mg and go up to 20 mg. It is usually paired with benzodiazepine like clonazepam, and clonazepam can be taken half SOS on a basis of panic attacks if the panic attacks are too much. And sertraline is an excellent option. Like we can start with 25 mg and we can go up to even 200 mg. Now, sertraline has got really good effects on anxiety. It's most preferred than even citalin, that is escitalopram. And in TCAs, we have amitriptyline, which is an excellent anti-anxiety. It's got an excellent anti-anxiety property because it's a tricyclic, and if a person is somatizing and there's headache and sleep disturbance, it's excellent drug. So it's better to go for a drug which is basically suitable for that particular person. We have to customize here. We cannot just keep a formula and go like that. We cannot follow exact guidelines because some people have a different comorbidity, the other may have a different comorbidity. By comorbidity, I mean panic disorder, anxiety and depression, anxiety and alcohol-induced anxiety. We can't put the person on, um, you know, uh, benzodiazepine exclusively on a person who's having alcohol-induced anxiety. We need something like a antidepressant, proper antidepressant like SRI. Sertraline would do a great job in alcohol dependence. So the dosage, as I mentioned, it's 5 mg to 10-20 for escitalopram. Sertraline will be 25 to 200 and TCA is again 25 to 200. So that this is the plan. Now, how are we going to plan it? Now, the same may be used as an objective in which the client is able to recognize the signs of escalating anxiety, is able to intervene so that anxiety does not reach a panic level, is able to discuss long-term plan to prevent panic anxiety when stressful situation occurs, practice techniques of relaxation daily. So, this is how we plan actually. Now, whenever patient comes to our clinic and all, we always give them a strategy, like a plan, like what is the plan now. So we divide it into psychotherapeutic plan and a pharmacological. Now, in psychotherapeutic plans, we have lots of options for them. We have alternative medicine. We have CBTs. We have supportive workup. We have so much. Now, in pharmacotherapy, some people voluntarily ask for a psychotherapy. So in that case, they are very much willing. Like you can see, they are able to recognize the signs of escalating anxiety. So which is in our favor. Now, even this kind of person who engages, who voluntarily, like we have lots of patients who already know yoga. Now, these people, when they develop GAD, actually it's easier for them to treat with their own talent or with their own skill, maybe that is yoga, with pranayams. So, the person who engages in physical exercise 3 times a week or performs activity daily, living independently, express satisfaction for independent functioning, is able to maintain anxiety at manageable level without use of medication, is able to participate in a decision making, thereby maintaining control over life situation, verbalized acceptance of life situation over which he or she has no control. So we have to instruct the client following anxiety reducing strategies. Now, this is all a part of non-pharmacological treatment. So it is progressive relaxation technique in the first mindfulness based meditation, slow deep breathing exercise, focusing on single object in the room and listening of smooth music, soothing music and relaxation tapes, visual imagery or natural related DVD productions. Now, progressive muscle relaxation is what I was talking about. Relaxing each and every muscle of the body, starting from the forehead, starting now. How do we do that? Now, first it is contraction and then it's relaxation. First it's contraction and then it's relaxation. It even goes to the periocular muscles, and then it goes to the nose, and then it goes to the cheeks, that is the buccinator and temporalis, and then goes to the neck. You contract your torticollis and then you relax it, and then it comes to the trapezius and then the rhomboid and all the shoulder muscles and then the chest muscles and the intercostals. Everything is made to, you bring the awareness to that particular muscle, you bring the concentration to that particular muscle, and you relax it. Now that is how progressive muscle relaxation works. Now you contract it and then you relax it. Now that's when they will realize that muscle was already contracted. Now, many people are not aware that that muscle is usually relaxed. They might think, but it may not be relaxed at all in the first place. So, that is where progressive muscle relaxation is going to do wonders. And then we have mindfulness based meditation. Mindfulness is, like we said, a person with high psychological acceptance of the present condition, that that person cannot do anything, and it is basically reduction of self criticism while observing and accepting the thoughts during the meditation process. Now that is mindfulness. And we have slow deep breathing exercises. It's like regular pranayams we can do, and focusing on a single object in a room, like it's just to increase the concentration. And listening to, this is music therapy basically, and visual imagery is one such coming up techniques where the person is just asked to imagine themselves. It's actually a part of hypnotherapy as well. So cognitive hypnotherapy is also very, very great um, technique that we are utilizing these days, cognitive hypnotherapy, where we restructure the cognition while in hypnotherapy. So assess the client in gaining control of overwhelming feelings and impulses through brief, direct verbal interactions. Individual interactions executed at appropriate intervals will reduce or manage clients' anxious feelings or impulses. Help the client structure the environment so that it is less noisy. A less stimulating environment creates a calming, stress-free atmosphere. Assess the presence and degree of depression and suicidal ideation in all clients with anxiety and related disorders. A thorough assessment results in early intervention that will possibly prevent self-harm. Now, this has to be mentioned because suicide and depression are so common in anxiety because patient is always feeling on the go and edgy. We don't know like what might happen. There could be an impulsive suicidal act or a deliberate self-harm as well. So it's very, very important to basically train them and also to make them aware of the impulses and to call for help. Administer anxiolytic medication at least as the least restrictive measure. Help the client understand the importance of medication and to take it as prescribed. Medication is an effective addition to other psychological therapeutic interventions. So these are my references. And thank you very much. Worrying is a waste of time. It doesn't change anything. It messes with your mind and steals your happiness. Thank you very much. Thank you.